This is going to be the fourth video of the antiviral pharmacology, and in this lecture we'll be discussing with you guys the anti-HIV virus pharmacology. In order to make this lecture easy, first of all, I will tell you people that how this HIV virus is infecting the cell, then inside that cell it is making its copies, then how those copies are releasing from the cell out, and then those copies are then ready to infect other new cells. First of all, I will tell you people about its replication pathway or life cycle. Now, what is the reason behind telling this replication pathway? Very simple. If you guys know this replication pathway, then it will be very easy for you to identify the pharmacological targets. And if you know the pharmacological targets, then it will be very easy for you to understand the mechanism of action of the drugs. That's why, first of all, I will teach you people about the replication pathway. And remember, this replication pathway that I'm going to teach right now is going to be specifically regarding the pharmacological targets. Here, I will skip some minor points which are actually not needed in the pharmacology. And if you guys are interested to learn more about this pathway, for that, we have already created a video. You can watch that also. Coming to the point, the first point, replication pathway or the life cycle of this HIV virus. And before starting the replication pathway, we must know that HIV virus is retrovirus. Now, what is meant by this term, retrovirus? We have a virus that is having RNA, and along with it, it's having reverse transcriptase, which is an enzyme, which is responsible to convert this RNA into DNA. Okay, from the RNA, a DNA will be synthesized by means of an enzyme, reverse transcriptase. Now, because of this mechanism, HIV virus is named as retrovirus. Now, let's come towards the point, that is the replication pathway or life cycle. Is this HIV virus finds the host cell? And this is the host cell, and this is the virus. If it finds the host cell, what will happen then? Then there on the host cell there are the receptors available on which these viruses will bind. Is they bind by means of GP spikes, glycoproteins. Now, these glycoproteins are available on the virus, and here the host receptors available. Now, these GP spikes, they will attach with the receptors of the host cell. Like this attachment will be done. After the attachment, there will be the endocytosis. Let me see what's visible. Yeah, it's visible. Let's come to the topic. Is this RNA finds this virus? After finding this virus will attach with this particular host cell, and what will happen after the attachment? Very simple. Is they attach, then there will be the endocytosis of this particular virus. Now, what will happen in the endocytosis? Very simple. The virus will move inside this host cell. And then the next step is the uncoating. The viral genetic material will be released. Now, this viral genetic material is actually RNA with its enzyme. Remember, there are several other enzymes available. Now, our very interest is with this particular enzyme, that is reverse transcriptase. By means of this enzyme, reverse transcriptase, this RNA will be converted into DNA. What will happen then? DNA will be synthesized. Then this DNA will move towards the host nucleus. And you guys know that there is the DNA available of the host cell. Now, what will happen then? With this virus, when this is coming into the host cell, it is having an enzyme with itself known as integrase. Now, that integrase will help in infusing the viral DNA with the host DNA. What will happen then? Simple, both the DNA will be fused. After that, a very interesting job is going to happen, that is the synthesis of the messenger RNA. Now, these both DNA, they will synthesize the messenger RNA, then that messenger RNA will come towards the ribosomes, and here that messenger RNA will be translated into proteins. Now, what will happen then? Very simple. Some of these proteins, they will synthesize the genetic material of the particular virus, means they will synthesize more RNA. Now, here at the end, we'll be having the proteins and RNA. In the meanwhile, one very interesting step is that when these proteins are synthesized, some of these proteins are having very long structure, long chain. They are not functional when they are synthesized. So what is going to happen then to make them functional? Again, there are some viral enzymes named as protease. Now, what they are going to do is very simple. They will come and they will do the splicing of this particular protein. Now, this one protein is now available into multiple fragments. Now, there are the fragments available of this particular protein. Now, these fragments are functional. Before, they were not functional. Now, they are functional after being broken by these protease enzymes. So, what will happen then? At the end, all these proteins and RNA which are synthesized, they will assemble. After the assembly, there will be the packaging. Now here, multiple copies will be synthesized. After they are synthesized, after the packaging, there will be the release of these copies. Now these are available to go and find more new host cells and infect those host cells. So like this, their cycle continues all the way long. Okay. Now let's come towards the next point, that is the pharmacological targets. Our targets start from the very first point, that is to inhibit the viral attachment with the host cell. Very first point, the very first target. Second target will be this one. Here we'll try to inhibit the conversion of the RNA into DNA. Means we'll inhibit the DNA synthesis. Then we'll inhibit the fusion of this DNA synthesis. This is our next target. And our next target after this will be the protease, this enzyme. We'll inhibit this one also. Now how these all portions will be targeted and how our drugs are going to treat these portions. Very simple. We have following classes. Number one, that is the attachment inhibitors. Second, NRTI, nucleoside reverse transcriptase inhibitors. Third, NNRTI, non-nucleoside reverse transcriptase inhibitors. Fourth, integrase inhibitors. And fifth is the protease inhibitors. These are the classes with us. Now how they are going to show their actions. Very simple. Attachment inhibitors, they will inhibit the attachment. Very simple. Here we have infobutide and maraviroc. These will inhibit attachment. If there is no attachment, then virus cannot enter. Very simple. Second we have is nucleoside reverse transcriptase inhibitors. Here I written abacavir / diadenosine. We do have some other drugs available. Now what are they? They actually, in a nutshell, what are NRTIs? Nucleoside reverse transcriptase inhibitors. These all are actually analogs. These all are actually the nucleoside analogs. Now what are nucleosides? You guys know this very well. Adenine, cytosine, thymine, guanine, etc. Now these are actually available with us. So when they are not phosphorylated, they are called nucleoside. After the phosphorylation, they will be called as nucleotides. And then you guys know this very well, that nucleotides are responsible and the building blocks for the synthesis of the DNA. So when we give these NRTIs, they are going to inhibit the DNA synthesis. How? Like, very simple. Here we have reverse transcriptase enzyme, and here is the RNA. Now this reverse transcriptase is busy in the synthesis of the DNA. Like this, what is happening? Another chain is prolonging to synthesize or to complete the synthesis of the DNA. Now what we are doing is we indicate NRTIs like abacavir, which is an analog of the nucleoside. So it will be first of all converted into nucleotide. So here's what will happen then. Now this nucleotide, it will come and will incorporate into the DNA. Now what will happen then? Very simple. Now before here the chain was going to prolong, is this NRTI comes here, NRTI. If this comes here, what will happen then? Very simple. This will inhibit the prolongation of the DNA. Means it will cause the chain termination. So like this, the chain won't be prolonged, and you can say that the DNA won't be synthesized. Very simple in short words. Next we have is NNRTIs. Here we have efavirenz and nevirapine and etc. Now what they are doing is NNRIs, non-nucleoside reverse transcriptase. They are not going to incorporate into the DNA, but they are actually non-nucleoside, means they are acting directly on the reverse transcriptase. They are non-nucleoside, they are acting directly on the reverse transcriptase, RT, reverse transcriptase. Here we have reverse transcriptase. What will happen? NNRTI will come and will inhibit this reverse transcriptase. So now if reverse transcriptase is inhibited, what will happen then? Again, there is no replication going to happen. Why? Because here our reverse transcriptase is no more functional. It was supposed to convert RNA into DNA. Now this is not available, not functional. That's why there won't be the synthesis of the DNA. So in short, NRTIs and NNRTIs are responsible to inhibit the DNA synthesis. After that we have is integrase inhibitor. In this we have raltegravir and dolutegravir. Now these are actually responsible to inhibit the integrase. Very simple. If we inhibit the integrase, what will happen then? Then these DNA won't be fused. If there is no fusion of these DNA, then it is impossible for this virus to synthesize the messenger RNA. And again, if there is no messenger RNA, then there is no translation, no protein synthesis at the end. And now remaining is the protease inhibitors. We got the concept that protease is responsible to synthesize functional proteins. Now if we inhibit this protease, what will happen then? Then there won't be the functional proteins available. Then the protein, which was having a long chain structure, that won't be split into small fragments, means that protein will remain inactive. So like this, by means of this pharmacology, we became able to inhibit the life cycle or replication pathway of this HIV virus. Hope you got. If still you have confusion, drop in the comment box.